Occasionally, in cleaning up cortical debris, one may encounter difficulties with pieces of cortex that are adherent to the posterior capsule. Subincisional cortex poses particular difficulties because it may be trapped behind the anterior capsule and may be difficult to access. Occasionally, viscoelastic may be useful in loosening up and speeding the retrieval of these cortical remnants. Here we see viscoelastic being injected underneath the last fragment of cortex and loosening the cortical material. It's important for the viscoelastic cannula to make contact with the edge of the cortical fragment so that the viscoelastic spreads underneath the cortex. Viscoelastic instilled above the cortex without loosening it from the posterior capsule will not significantly assist in the removal of this cortical debris. If the viscoed cannula is properly positioned, it can be used to raise up the edge of the cortex, and the viscoelastic material can then spread underneath the cortex and loosen it. A wave of viscoelastic will often be seen to move out peripherally and may further help to loosen the cortical debris and assist in its removal. Often the lens may then be inserted underneath this last fragment of cortex, making a cleanup of this debris very rapid and quick and efficient, and saving some surgical time. This may also increase the margin of safety in cleaning up this last remnant of cortex. Here we see another example of a patient having undergone most of his phacoemulsification procedure. In this particular instance, we have some Fuchs dystrophy, which makes visualization somewhat more difficult. And here the surgeon has also elected to inject viscoelastic underneath the edge of the cortex. The positioning of the cannula, again, is quite key in actually separating the cortex from the posterior capsule instead of merely coating it. After this is completed, the lens is easily inserted and the remaining cortex can be removed very rapidly along with the viscoelastic. When visibility is compromised, this provides a quick, safe, and effective method of removing the last portion of cortical debris, which is subincisional. It's also quite useful in situations where there is a broad sheet of anterior capsule, which makes access to this cortex more challenging. Very minimal effort has to be exercised in removing this cortex, as it is usually free-floating and disattached from the capsule in all directions. In this particular instance, we have a patient who has undergone previous PTK to remove calcific deposits from the cornea. However, there is still some residual calcification peripherally, which does limit visualization of the peripheral cortex to some extent. Once again, in this instance, the installation of viscoelastic or viscopersuasion is used to loosen up the residual cortex and increase the safety, speed, and efficiency of removal of the last piece of cortex adherent to the posterior capsule and the cortex that is found subincisionally. Optimally, the lens is positioned beneath any residual cortex, and this aids in the speed of aspiration. Thus we see viscopersuasion making a moment in the surgeon's life a little bit easier and optimizing our procedure.